Could you please tell us a little bit about yourself, your background, and current positions of work?
My name is Alexander Khoruts. I'm a professor at the University of Minnesota in the Department of Medicine Division of Gastroenterology. I'm the director of the Microbiota Therapeutics program here, which targets the gut microbiome with therapeutics.
Thank you.
And then our second question and the focus of our project is, what do you think that the average person should know about the gut microbiome and how it works?
Well, all creatures on Earth are in symbiosis with microbes one way or another. So that's true for all mammals, including humans. Most of the microbes in our body are in the digestive tract, mainly in the colon. And the microbial communities that live there are highly organized and adapted to the human host, and they're really part of the human body. So they're integral to human physiology. It's thought that many of the modern diseases, ranging from allergies to autoimmunity to certain cancers to neurologic disorders and neurodevelopmental disorders, have something to do with changing microbial composition in the gut, although the mechanisms remain largely unknown. So while we believe that that aspect of gut health is very important to human health in general, this is still a very young field. And what should an average person know? I think an average person should appreciate that there's something important there, but at the same time not fall for a lot of the hype around it, which there's plenty of, ranging from diet fads to probiotic industry.
Thank you.
Thanks. Moving on and building on this idea, what do you think? Could you explain in simple terms that are accessible to the average person how antibiotic use affects the gut microbiome composition and their health in general?
Well, antibiotics clearly have been a major step for modern medicine, right? Undoubtedly saved many lives, so we can't just come out and say antibiotics are bad. Antibiotics are important, but perhaps over the decades of their use, physicians have used them with relative impunity, not really thinking of the long-term consequences, or in the population or in the patients. So we have to recognize that the antibiotics may have adverse events that are not necessarily appreciated by conventional metrics. So, for example, when the regulators like the FDA approve an antibiotic, they see, does this antibiotic work against this infection? And the readout may be a couple weeks, a couple months, without necessarily appreciating that in some patients the consequences of that could be manifest decades later. So there's just not a requirement to go through that kind of a research work. Your question was specifically about antibiotic resistance, or was it broader than that?
So the question was how microbiome is affected by antibiotic use, and what does it mean for the individual in the long term?
Okay.
Yes.
Microbiome in general.
Mm-hmm.
Yeah.
Well, there is probably more concern on antibiotic use in the very young people. And by young, I mean first year or two of life. and that's when a lot of the systems in the body are developing, including the microbiome, but also the immune system, the nervous system, your energy metabolism, everything's getting hardwired. And that early life exposure to antibiotics, which may disrupt normal development of the microbiome in the gut, may also send the immune system on a trajectory that will manifest as autoimmune disease or inflammatory bowel disease or certain cancers, etc. That's difficult to study, right? Because the effects of that early use may become manifest like 2 decades later. But that's more than several grant cycles for an average academic, so it's hard to design those kinds of trials, and the drug companies are not required to do that. So what we have is correlation data, so people can look back, and particularly in places where those records are available, like countries with socialized medicine, where you can look at systematically at things like antibiotic utilization. And there's correlations that have been shown that early exposure to antibiotics increase the risk for things like Crohn's disease, allergies, obesity, etc. Whether or not, how exactly that works, it's still speculative. So that's kind of the broad theme. It's related to what's been earlier described as the hygiene hypothesis, which is even a broader idea, where a correlation was made that as infectious disease went down in the population, we had a surge in new diseases. Not necessarily completely new, but much more frequent than they used to be. Things like allergies, asthma, autoimmunity, again, certain kinds of cancers. Now we're having an uptick in young people getting colon cancer, for example, in the population. So it was speculated that, well, if the immune system is not fighting infections, it's going cuckoo and causing other diseases. That was the original hygiene hypothesis. Now it's been kind of complemented, well, maybe the effect of all this hygiene has really been on the microbiome, and how the immune system interacts with that is not necessarily the way it was meant to be through evolution.
Thank you.
Could you please tell us more about your microbiome research and your work at the Microbiota Therapeutics?
Sure. Well, I'm a physician, and so part of my time is spent in clinic. And a patient I saw back in 2008 really steered my career in this new direction. And it was not unique or particularly rare patients. Patients like this were being seen all over the United States. And what she had was a C. difficile infection. There's this organism now called Clostridioides difficile, used to be Clostridium difficile, which is an infection in the colon. And the problems that it causes were recognized as early as 1950s, although it wasn't quite appreciated that it was C. difficile that was causing them. But it was understood that this is a complication of antibiotics. So essentially, as soon as antibiotics showed up in clinical practice, people were seeing some complications, and this is one of the most common ones. So basically, it's an infection in the colon, and it results from antibiotic usage. And what happens is, you take antibiotics, it's like throwing a grenade into your microbial community in the colon that disrupts that community and makes it vulnerable to invasion. C. difficile is actually an organism that likes to live in the colon. It's related to all those organisms, but it makes toxins, and it causes diarrheal disease. And sometimes it can cause complete dysfunction of the colon. If the inflammation is so severe, the colon stops working, the gut barrier is broken, and it results into what's called fulminant C. difficile infection, which is a highly fatal condition. So another problem with this infection is it's once it sets in, it can be very difficult to get rid of. And that's because it's an antibiotic-related problem, but it's treated with antibiotics. So you have an infection, you treat it with antibiotics, but now you're choosing antibiotics that against an organism that is adapted to live in the colon, so you kill a lot of its relatives as well. So that becomes a really devastating therapy for the gut microbes. But this organisms also make spores, which you cannot kill with antibiotic. So you stop the antibiotic and the infection comes back. It becomes a recurrent problem, and people can just keep stuck with it. They either keep taking the antibiotic forever just to keep it under control, or deal with infection that doesn't go away. So they really don't have a choice. And so the simple solution that was actually introduced way back in the 50s again is you put the microbes back in, the healthy ones. So that was published by a group in Colorado. And it enjoyed a brief upsurge of activity around the country, including the University of Minnesota, where people still remember Dr. Wangenstein doing some fecal enemas for patients back in 1960 or so. Then an antibiotic called vancomycin came out, which actually happens to be quite good against C. difficile, and the problem went away until it came back again. And so in early 2000s, many physicians, including myself, were encountering patients with that recurrent C. diff infections for which vancomycin was no longer curative. And so we had to bring back that old therapy of trying to repair the microbial community from the antibiotic damage. That was kind of the initiator. We demonstrated in that patient that when we do something like that, we're able to engraft donor bacteria from the healthy donor into the patient and restructure their microbiome. And from then on, it was one case, but then more cases started coming, and basically that's how we developed this program then, focused mainly on patients with these difficult C. diff infections. And as that program, that became really a leading program in the world on doing this, because as crude as it sounds, that was not quite implementable in mainstream medicine. So we had to convert what started as a slurry of stool to what looks like a drug. So the preparations that we use now are microbes that are separated from stool, and then they're preserved either as a liquid suspension that's frozen or freeze-dried and put into a powder in a capsule people can just take. We still really do focus a lot on the C. difficile infections, but the main other mission of the program is to support all kinds of academic investigations, early phase investigations in a variety of diseases, ranging from inflammatory bowel disease to certain cancers, optimizing cancer therapy, to food allergies, to autism. Basically, since you can connect microbiome to so many different health problems, there's a lot of interest in trying to modulate or remold the microbiome and see what effect it'll have on different diseases.
To add to that, I also heard that microbiome is a second immune system, right, in the organism. It's like I guess a funny way to look at it. All right, question?
So just to begin to wrap up here, What have we not talked about yet that you feel is important for listeners, for the average individual, to know about the topic of the microbiome, of IMT? What else would you like to share?
You could have a podcast for weeks,
Right.
nonstop. So I'm really not sure where this goes. People are interested in, okay, how do I keep my microbiome healthy? That's a common question. People are worried maybe about taking antibiotics. People are worried about whatever diseases that may be related, particularly when their kids get treated. People may be wondering about various probiotic products. There's a lot of microbiome testing companies these days that are offering sophisticated looking diagnostics, often in combination with probiotic products. There is a lot of misinformation, disinformation. There is lack of education or understanding of how different products are regulated in this country. What are you allowed to claim? For example, the probiotic industry, as it exists today, takes advantage of a major loophole or gap in understanding, in that they sound like these are health products that should do good things, but the only thing the regulators require them to say is they cannot claim that they can treat, mitigate, or prevent a specific disease. Every other claim is allowed. So they can say that this will benefit your digestive health. This will improve your immune fitness. Whatever that means. Nobody knows what that means. It's an allowed claim. It's a great marketing. It sounds better than this treats your atopic dermatitis or something. And this is not understood, not by patients, not by physicians, not by all kinds of healthcare providers. It's an $80 billion industry that philosophically the regulators have accepted people are free to waste their money. They thought to be these products are probably benign and don't cause harm, but realistically they're not really tested in any way to know what exactly value they bring. So to some of the questions on patients asking, what can I do? I try to steer the direction toward a healthy diet, simply on basic principles on on how the digestive tract in humans is put together. So we are hindgut fermenters. That means is the way our digestive tract is put together is that we have microbes finishing the digestive process in the colon, which is the last part of the transit. So whatever didn't get digested and absorbed before will then hit the colon, where things really slow down to allow time for fermentation. And those microbes will produce some, well, of course they will eat and consume calories themselves. They'll actually make some products for the host as well, which are again are part of our physiology. So when you're eating ultra processed food that is so industrialized that it's very well digested and absorbed upstream before it reaches the colon, you're in essence starving your gut microbes. So to keep them well nourished and healthy, it comes down to really an old-fashioned medical advice, is that more plant food is better for you than red meat, for example. Diverse sources of plant food is better than eating a monotonous diet every day. So whole grains, leafy greens, fruits, vegetables, berries, legumes, as many different kinds as possible is probably a good idea for that microbial health. Now, it could be that your microbial community is already compromised by people that came before you, because you got your microbes from your mom, and she got her microbes from her mom, and people around them who've all been taking antibiotics and eating junk food. So if you look at the Western microbiome, it's already less diverse than those of ancestral populations, and maybe less capable of doing things that we're supposed to do. But this is still, we have what we have. There's a coevolution still occurring. So that's basically what I tell patients is not to get sucked into advertising, not to waste their money on microbiome diagnostic, which doesn't exist yet, but can be sold. Again, it's another unregulated industry right now of direct-to-consumer laboratory testing. But spend a little more time cooking wholesome meals. Make sure you have plant foods in your diet along with everything else. Be cautious with antibiotics. It's not that antibiotics shouldn't be taken, they're obviously life-saving, but be judicious about them. So when a physician writes a prescription, it's an easy thing to do, and when the appointments are 5 to 10 minutes long, that's kind of the easiest thing to do. But you really have to question if you're having, like, say, a cold or something, is like, what exactly are we treating? About 50% of antibiotic prescriptions are thought to be inappropriate, according to the literature. So it's a good thing to pause and really question that. Those are probably the kind of the main public messages. But you could ask a lot more questions in different directions.
Do you guys have any follow